So welcome to module number 6, putting it all together. And today in this module we're going to do just a little quick review of all the modules that we've been through already, and then I'm going to move on and talk about supplements, troubleshooting and retesting in section number 4. We'll talk about reducing antidepressants the safe way in section number 5, and then we'll finally talk about further integrative medical testing and where to from there after that. So as you know, we've gone through 4 key modules. In module number 2 we talked about optimizing your diet. Then we talked about addressing food sensitivities, supporting gut health and treating nutritional deficiencies. So right now we're just going to talk a little bit about optimizing your diet and reminding you about some of the key takeaways. So we talked about 8 essential dietary keys for enhanced mental health. I told you that you need to make sure that you're eating enough protein, include some good fats in your diet because your brain is largely made out of fats. Also include ample amounts of vegetables and remember how I spoke about potassium and how it was a key mineral for your mental health. That was one of the ways that you could reduce anxiety or panic attacks for some people. Also, going caffeine free will reduce anxiety and panic for some and improve your sleep. In module number 3 we talked about balancing your blood sugars, going gluten free and dairy free, and we'll talk about that in a moment. But one of the key takeaways from module number 2 in optimizing your diet was the way that you could plan your meals every day, and it was a real practical way to make sure you're getting all the nutrients that you need in your diet. So I gave you some recommendations and some ideas about what meals you could plan, but the thing is, the best way that I think is to start with your protein source. Start with what protein you want to eat, and this should be a quarter of your plate or a size of the palm of your hand. Secondly, you add a healthy carb, and in the Real Relief Real Food Planner I give you a list of healthy carbs that you could include, but things like kumara and oats and quinoa and rice, so all gluten-free healthy carbs. And the healthy carbs should be about the size of your fist, so that helps you with portion control. Also add a serving of healthy fat. So this could be olive oil, could be a handful of nuts or seeds, could be avocado or a quarter of a cup of coconut cream. My advice is to include at least 1 serving of nuts and seeds per day because it's going to help you improve your mineral levels like magnesium and zinc too. Finally, with the plate planner, add some non-starchy vegetables. So this should be half of your plate, and that will be 2 to 3 servings of vegetables. And those vegetables are going to be high in folate, they're going to be high in potassium, and it's going to be really great for your mental health. The protein sources that you could include are eggs 3 times a week, chicken or poultry 2 to 3 times a week, fish 2 to 3 times a week, but remember to limit tuna just to once a week, and also large fish should be just eaten sparingly. Include red meat 3 to 4 times a week because red meat is really key to get your vitamin B12 and your iron levels up. Okay, and finally include some legumes 3 to 4 times a week. The legumes will provide not only protein but also good levels of minerals such as iron and magnesium. So my suggestion is to aim for 1 gram of protein per 1 kilogram of body weight. So if you're 60 kilograms, aim for 60 grams of protein per day. You actually have to be really intentional about this. And if you're heavier, so if you're 100 kilograms, you need to be aiming for 100 grams of protein per day. That means you need protein at every meal. So if you follow that plate planner rule, that will help you get very close. And remember that we've got the Real Relief Real Food Planner bonus document for you. So make sure you've downloaded that from the membership site. It has lists of all the magnesium-rich foods, the omega-3 rich foods, iron, vitamin B12, and it's also gives you that plate planner document and recommends different vegetables to eat and healthy carbs too. So in the course we also discuss about what you should be drinking. To keep it simple, the thing that you're supposed to be drinking mostly is water. So learn to love water. Maybe carry a drink bottle with you wherever you go, or if you work at a desk, have a glass drink bottle on your desk, but make sure that you're consuming that. It's going to help your gut health and help flush out toxins and keep you regular. So you can also drink a small amount of coconut water, and coconut water is great for increasing your potassium levels, and 99% of women and 95% of men are deficient in potassium, and so that's a key one for anyone with anxiety or heart palpitations. A small amount of red wine, a couple of glasses a week could be good for your antioxidants, but definitely don't overdo alcohol. Water kefir and caffeine-free kombucha are another great way to support your gut health, and decaf coffee and green tea may be an option for you if you're not sensitive to caffeine. So one of the things that I want to repeat over and over again is not to drink caffeine or eat caffeine if you have panic attacks or anxiety. So please don't ignore me on this one. I know that sometimes it can be hard to reduce that caffeine and get off it, and I know that some of you may feel like you need it for motivation and energy, but do your very, very best to get off caffeine, especially if you've got panic attacks or anxiety. It's also going to help your sleep if you reduce the levels. Okay. So following these guidelines, the 8 essential dietary keys for mental health will help balance your blood sugars. It will lower inflammation in the brain and the body. It will lower oxidative stress. It provides amino acids for neurotransmitter production, and it supports gut health. And most importantly, it will help improve your mood, reduce your anxiety, reduce mood swings, stabilize and increase energy levels, and even increase life satisfaction. So please follow my guidelines. Use the plate planner to build your meals, and include protein at every meal and lots of vegetables too. So next we're going to talk about addressing food sensitivities. And in Module 3, we spoke about blood sugar imbalances. We talked about going gluten-free, dairy-free, and also possibly following the low FODMAP diet. So remember with blood sugar imbalance, how it can affect you. So either it can affect your energy levels, giving you energy at times, and then lowering your energy when your blood sugars are too low, or it can even impact anxiety and panic attacks. So when your blood sugar levels get too low, the panic attacks come from the adrenaline rush that your body creates to bring your blood sugar levels back up again. So with anyone with anxiety and panic attack, you need to address this, and here are some of the keys. Avoid or limit sugary foods, especially on an empty stomach. Okay, so breakfast is not the time to indulge in sugar. Also include protein and healthy fats in every meal, and this helps stabilize your blood sugars. It stabilizes the speed at which the glucose is released into the bloodstream. And if it's stable, you don't get those dips in your blood sugars, and then you don't get the adrenaline rushes. And if you don't get the adrenaline rushes, you can really limit anxiety and panic attacks. Remember not to skip meals. In anyone with anxiety and panic attack, I would initially try to eat 5 to 6 times a day. So eat frequently. Don't go 4 hours without eating. Even 3 hours may be too long for you. My recommendation is to eat at the first sign of anxiety or before. And remember, I gave you some subtle signs that you might be having low blood sugar. So you might yawn, or you might forget your words, or you might start feeling a little bit confused, or have a little bit of brain fog. That might be showing that your blood sugar levels are dropping. And finally, if you do have problems with blood sugars, you do need to optimize your diet and what you're eating, but also consider some supplements. Chromium's great, especially if you've got sugar cravings. Alpha lipoic acid is good too for balancing blood sugars. And then finally, CoQ10 and PQQ, which are mitochondrial support supplements, can be great for people that just can't get on top of the reactive hypoglycemia. So next we're going to talk a little bit about gluten, and as it's one of the 8 essential dietary keys for enhanced mental health. And do you remember this quote from the Frontiers in Human Neurosciences? It says, a grain-free or gluten-free diet could improve the mental health of many and be a complete cure for others. So it's my recommendation that everyone with poor mental health goes gluten-free. So what's the problem with gluten? Well, it can increase gut permeability, so it can lead to leaky gut. The gluten also stimulates the immune system and is very inflammatory. And as you know, with poor mental health, it is correlated or associated with high inflammation in the body and in the brain. So we want to lower that inflammation. Gluten also has opioid-like properties and can also be quite addictive as well, and can impact mood and behavior. So should you be eating gluten-free? Well, if you had a positive result to the celiac test, you definitely need to be gluten-free, and you need to do that for life, and you need to do that very strictly. And you need to find a celiac disease society in your country and get advice from them about how to be truly gluten-free and not have any be exposed to any contaminants. But if you have depression, anxiety, muscle pain, or an autoimmune condition, then I also highly recommend that you go gluten-free. The next food sensitivity that we spoke about was dairy intolerance. And remember that some of the symptoms of dairy intolerance, one was digestive symptoms like bloating and belching and tummy discomfort. But sinusitis and asthma, postnatal drip, eczema, these are symptoms of current dairy intolerance, mostly to the casein. Also, chronic earaches and tonsillitis or dairy intolerance as a child may indicate you still have problems with dairy and should stay off it. So my general rule when it comes to avoiding dairy products or not is that I recommend that everybody should be gluten-free with poor mental health, but you also should be dairy-free if you show those current symptoms that I just discussed, or if you have a history of dairy intolerances as a child. Now, I also discussed the low FODMAP diet in module number 3, and the low FODMAP diet is a diet created by the Monash University to treat irritable bowel syndrome. Now, FODMAP stands for, is an acronym for a group of short-chain carbohydrates and sugar alcohols. But basically the diet is that you eat foods that are low in FODMAPs, and there's just a list that I provide you with, and you avoid high FODMAP foods. It's not a great long-term diet, but it's great for reducing symptoms. And the symptoms that I usually use to decide whether a client should trial the low FODMAP diet or not is gut and digestive symptoms, so like bloating and belching and flatulence and diarrhea or constipation, but also brain fog and fatigue and possibly anxiety. and also yeast infections, so vaginal yeast infections, urinary tract infections, or sinusitis. So if you have any of those symptoms, it would be my recommendation that you go back to module number 3 and learn about the low FODMAP diet and trial that strictly for 2 to 4 weeks. Remember, I have the low FODMAP dietary resource for you available at the membership site. So next we're going to talk about supporting gut health, and we'll do a quick review on that topic next. So let's now review the section on gut health. And remember, it was Hippocrates that says all disease begins in the gut. I personally think this is very true for many patients, but not all. I've seen a lot of clients get well without addressing gut health. But if you've got any of the symptoms, the following symptoms on poor gut health, then you really need to address it, and it's high priority for mental health. So if you've got any digestive symptoms like bloating and belching and flatulence, nausea, indigestion or reflux, diarrhea or constipation, a sense of fullness after eating, rectal itching, or really severe ongoing deficiencies such as iron and vitamin B12, then you need to think about poor gut health and doing something about it. But there are other symptoms that can show that you have poor gut health too. So brain fog, fatigue, depression, anxiety, and even autism can be a sign of poor gut health. And systemic immune problems too, like vaginal yeast infections, urinary tract infections, sinusitis and asthma, autoimmune conditions and eczema, all of these can show that your gut health needs some work as well. So in the module we went through 5 different areas to support gut healing. Firstly, we removed constipation, so making sure that you're having a bowel motion every day. So if you're still not, that would be one of my recommendations too, is just to get your bowel motions moving, and that will help heal your gut. We talked about removing particular foods and trying to get rid of certain medications too, if that's an option for you. The replacing section, number 2, was about making sure that your stomach acid levels were good and strong so that you're digesting your food properly. Number 3, reinoculation, was all about prebiotics and probiotics, and we learned about the different foods that you can eat to help feed the good bugs in your gut, and also probiotic supplementation too. We talked about repairing a leaky gut and helping heal the lining of your gut. And one of the key recommendations here is to try to increase your intake of collagen. And that could come by using collagen protein powder to heal the lining of your gut. It could also be through drinking broths or eating sort of particular marshmallows, homemade marshmallows and gummies. I've given you a recipe in the membership section as well for that. But healing the lining of the gut, then also rebalancing your stress levels, because as we learnt in the gut health section, your brain and your gut, they interact, and it's a two-way conversation. So as well as working on the gut, you really need to work on reducing your stress as well, as much as you can. And finally, I talked about removing opportunistic bacteria as well, and using my antimicrobial herbs to do that. So here's just a summary of some of the strategies that I talked about in the gut health sections. Remember, it's about an hour long, so I can only summarize these things here. There's a lot more detail in module number 4 on that. But here's some strategies that everybody can do, even if you don't have poor gut health. So get some broths into your diet, have some collagen powder perhaps, eat lots of vegetables because this provides lots of fiber and food for the good bacteria. Limit your sugar intake and also reduce gluten. Reducing gluten will lower inflammation of the gut and help heal leaky gut as well. Diaphragm breathing to try to manage your stress. Eat fermented foods if you tolerate that, such as sauerkraut or kimchi. And take some apple cider vinegar, and you could put that on your salad dressing, or you just have that in a glass of water with your food or with your supplements too. So for anyone with digestive symptoms, here's also some other recommendations. Get your bowel motions moving. Okay, you need to be having one bowel motion a day, and if you're not having that, if you're only having it every second day or third day, make this a priority. So you could do this by using LSA, magnesium citrate or vitamin C, or purely just increasing your water intake and vegetable intake as well. Make sure you test your stomach acid levels and supplement with betaine hydrochloride if required. Consider the low FODMAP diet too for people with a lot of brain fog or a lot of digestive problems. I've seen low FODMAP diet actually help someone that was having daily diarrhea, like 5 or 6 bowel motions a day, and in about 3 days the low FODMAP diet got her back to having 1 regular bowel motion a day. It can be quite miraculous for some people. Okay. Also consider taking a probiotic, 1 capsule before bed. Also repairing your gut. And so there is some gut repair supplements that I've recommended. And also finally, for people that have found it very difficult to treat their poor gut health over a long period of time, if you feel like you're resistant to actually getting on top of it, my recommendation is that you take some mitochondrial support, as this can help your immune system and provide your body with some energy, so then the immune system can help heal your own gut and get on top of the infections. For those with digestive symptoms, my suggestion is that you follow those initial guidelines for about 3 months, and if you don't have enough improvement, then you follow these next steps. So you would add oregano oil and antimicrobial formulas for a period of 6 weeks, and you take those 3 times a day. You would then stop for 2 to 4 weeks and assess your improvements. So if you've improved, then good, carry on with all those maintenance options for just helping heal your gut and improve gut health. But if you don't have adequate improvements, repeat this protocol with the oregano oil and the antimicrobial herbs for another 6 weeks, and make sure that you're trying to manage your stress with diaphragm breathing or mindfulness. So in the next section, we're going to talk about treating your nutritional deficiencies. Nutritional deficiencies are my favorite topic, and I think they're so regularly overlooked. And in module number 5, we talked about 8 nutritional imbalances. We talked about the deficiencies in the minerals iron, magnesium and zinc, as well as copper overload. We spoke about omega-3, the essential fatty acid, as well as 3 different vitamins: vitamin B12, folate, which is vitamin B9, and vitamin D as well. I'd be really interested in hearing if you have found that you are deficient in any of these minerals or vitamins, or if you resonated with the symptoms of a magnesium deficiency or omega-3 deficiency too. Maybe send me an email or let me know through the regular question and answer sessions. So one of the reasons I love nutritional imbalances so much, I think, is because you can get reasonably quick results with treating these deficiencies. If you find out what you're low in and you give your body what it needs and you bring it back to balance, it can make such a difference in your mental health and in your energy levels. So in module number 5, we talked about blood test results and how you might have a normal level and it's in the normal reference range and your doctor says fine, there's nothing wrong with your results. But the question is whether those levels are optimal or not. And I've recommended optimal levels for the nutrients that we have tested. So module number 5, we walked through interpreting your blood test results for the different nutrients, and we discussed what a severe deficiency was, what a deficiency, and what an optimal level was for the different nutrients. Now, if you're feeling unsure about that or would like a second opinion, realize there is an upgrade option available in which I'll interpret or analyze your results, or one of my trained team will do that for you, and will write up an individualized report showing the areas that you need to concentrate on most and how to rectify those deficiencies and how to bring your body back into balance. So I'd like to ask you today, are you deficient, or do you have an imbalance in any of the following nutrients? Did you find that you had low folate or iron levels, or vitamin B12, magnesium, vitamin D, zinc, or omega-3, or did you have a copper overload? So what I want you to do is write down those areas that you were most deficient in and prioritize those, okay? And there's 4 areas that you need to consider. So firstly, supplementation. So if you have a severe deficiency or deficiency in a nutrient, I highly recommend that you consider supplementation. So get the supplement in and get your body, give your body what it needs, and bringing it back into balance will help your mood and your energy levels, and also calm your anxiety. Once you've got those supplements on board, then have a look at your food choices. So I want you to look for foods that are high or rich in that nutrient, and I want you to eat them. Okay, in the Real Relief Real Food Planner, which is a bonus document in the membership site, there are pages on each of the nutrients, and they'll show you foods that are rich in that nutrient that you need to eat to improve your levels. Also, if you've got a number of nutrients that are deficient, maybe consider your gut health. So number 1, make sure you've done that stomach acid test, and if it's low, be supplementing with betaine hydrochloride, or at least using apple cider vinegar to acidify your stomach and help with digestion and absorption of nutrients. With vitamin D, if you are deficient in it, consider getting out in the sun more often, okay, and exposing your skin to the sun to improve your vitamin D levels. So next we're going to move on and discuss supplements, troubleshooting, retesting, and maintenance too. So now I just want to talk a little bit about supplements and give you some guidelines when it comes to troubleshooting, retesting, and maintenance. So remember that there is the Real Relief Supplement Guide, and that's a bonus for you, and you can find that in the membership site. So realize this is just a guide of suggested supplements. In no way does it mean that you need to be taking all of those supplements. Just based on your symptoms and going through the training, if you identify that you have a need for a nutrient, then you go to the supplement guide and see what supplement options are available there for you. So if you're taking a supplement and you think that you might be having a reaction to it, here's a few guidelines. We discussed this in module number 5, but stop all your supplements or the most recently introduced supplements if you're feeling like you're having a reaction to one of them. The second thing is wait for the symptoms to resolve. If it does, then one of your supplements may be giving you the symptom. Then reintroduce the supplements one at a time, every 3 to 5 days, and monitor whether the symptoms reappear and which supplement caused it. So don't continue a supplement if it isn't right for you. Okay, look for an alternative. If you were treating a specific deficiency, trial a different form. So rather than a citrate, maybe try a glycinate. or trial a different product with a slightly different ingredient list. It may have a different herb in it, may not have any B vitamins, or it might even have a filler in it that you're just reacting to badly. And the final recommendation is maybe lower the dose. You may be able to tolerate a low dose of that supplement, but you just might not tolerate it at a high dose. Another question I want to address is, how long should you stay on supplements? Well, really, there's no easy answer. I suggest that you start on higher dosages for 3 months to build up the body's levels in that nutrient, and then trial lowering that supplement to a maintenance dose. And also retest your blood levels to monitor your need. But saying that, I've come up with 4 different suggestions or things to consider when you're wondering about supplementing with a supplement long term. So we will consider retesting. I'll also give you some specifics for certain supplements, and then we'll consider causes and trialing as well. So with retesting, I recommend that after 3 months you retest your levels, and then you test after another 6 months, and then yearly after that. Remember to stop your supplements 3 days before your blood test, just so that you get a true reading of the nutrient levels in your body. So when you're doing testing, repeat testing is especially vital for vitamin D, zinc and iron. So if you're taking high dose vitamin D supplements, which is more than 2,000 international units daily, I'd recommend retesting regularly, because vitamin D is a fat soluble vitamin and can build up in the body if taken at high dosages for too long. If you're taking zinc at high dosages, more than 25 milligrams a day, I would recommend repeat zinc and copper testing regularly, because zinc supplements can lower copper levels. And if you're taking iron long term, you also need to do follow-up testing, because if iron builds up too high in the body, it is bad for the brain because it's very oxidative. So with your repeat blood tests, if your levels have not improved after that 3-month period or 6-month period, increase the supplement up to the maximum dosage that I've recommended. Or if you're already on that high dose, continue it. And think about addressing the causes too. So review your diet and your lifestyle choices for that particular nutrient. So with vitamin D, think about getting out in the sun. With iron and B12, make sure that you're incorporating rich iron and vitamin B12 rich foods in your diet as well. If your levels have improved when you've retested them, reduce your supplement dose by 50% and retest your levels in 6 months' time to ensure this dose is adequate. And so when you get the retest results back, make sure your levels have stayed in the optimal zone. If after retesting you find that your levels are really high, reduce your supplement dose by 50% and retest your levels in another 6 months' time to ensure your levels are optimal. So I've just got a few specific recommendations here. So with iron, if you have heavy periods, don't eat much iron-rich food, or have poor gut health, you may need to supplement your iron long term. Okay, it's vital that you retest your levels regularly. My suggestion with omega-3 is, if you don't eat fish, then you should be taking omega-3 supplements long term. If you are on a vegan diet or vegetarian diet, or you don't eat much red meat, then you may want to take B12 supplements long term as well. With vitamin D, if you have dark skin or you don't spend much time outside, it's likely that you're going to need ongoing maintenance dosages of vitamin D. So again, do your retesting, but continue with vitamin D supplementation if these recommendations apply to you. With zinc and vitamin B6, it's possible that you're going to need to take it long term, especially if you have pyroluria. So remember, we talked about that in the zinc section, and one of the kind of hallmarks of pyroluria is that you have low tolerance to stress, and mental health runs in the family. But remember to do zinc and copper retesting regularly, just to make sure that they stay in the optimal range. When it comes to wondering whether you should take a supplement long term, here's another thing to consider: the causes. So reducing supplements or not depends on the cause of the deficiency. If you've rectified your diet, you may be able to reduce or stop the dose of the supplement. If your lifestyle continues to be stressful, you may need to continually compensate for it. So you may need to take magnesium to compensate for that stress. If there's a genetic cause, you most likely will need to continue to take that supplement long term, as well as supporting yourself via your lifestyle and your diet. And if your gut health continues to be poor, you may need to take specific supplements that you don't absorb well. But my recommendation is trial reducing your supplement dosages. Okay, after a period of time, your resilience should increase. So this is only when your mood has improved. Maybe after 6 months, you may choose to decrease the dose of some of your supplements. Only reduce one supplement at a time though, and monitor your symptoms over the following month to ensure you don't go backwards. So if you do go backwards and you're starting to feel a little bit more low in your mood or higher anxiety, you'll kind of realize that that supplement is good for you, and you need it at the higher dosages, so put the dose back up. So there's a few ideas for you when it comes to taking supplements long term and how to create a maintenance plan for you. And next we're going to go on and talk about reducing antidepressants the safe way. So in this section we're going to discuss reducing antidepressants the safe way. Please realize that I'm not a medical doctor, I'm a doctor of biochemistry. So before you reduce your antidepressants at all, you need to be talking to your medical doctor who has prescribed the medication for you. But saying that, here's just a few things to think about when considering reducing your medication. So firstly, address the root biochemical causes of depression and anxiety, and that's what we've been discussing in this course. So look at your diet, make sure that you've addressed any issues with a low protein diet or blood sugar imbalances. Also look at your gut health and treat any low stomach acid, leaky gut, poor bacteria in your gut, and also look at nutritional deficiencies. My suggestion is also to look at genetic weaknesses, and we'll talk about that in the last section, and also balancing your hormones. My recommendation is always to stay on your medication while doing this. You only want to go off your medication when you have felt an improvement in your mood and you've put things in place to support you while you're reducing your medication. So build your resilience and reduce your stress levels, okay? And consider cognitive behavioral therapy, or CBT. People that do CBT and have learnt CBT are known to relapse into depression at a lower rate. So only when you feel improvements in your mood for a sustained period of time should you consider reducing your medications. I would suggest 6 months or so. When you feel ready, talk to your prescribing medical doctor. There are no clearly established procedures for tapering antidepressant medications, but please follow their advice. Ask for their advice because they are experienced in this. So please don't rush. It's not a race. The faster you taper off your medication, the higher the risk of having side effects. So do this slowly. It's okay to be on medication, but also don't be afraid of coming off them. So my suggestion is plan reducing your medication around your life. So are you going through anything stressful right now? Well, now's not the time to reduce your medication then, is it? Does your life have more stressful periods, such as Christmas or end of year accounts? Well, I would suggest that you avoid these times a year and possibly start a month after the stressful time is over. Does your life have some more relaxing periods or low-key times of the year? This is when I would suggest that you consider reducing your medication, or plan to finish your medication around this time when the stress levels are coming off. So how fast do you reduce the antidepressant medication? Well, I'm sorry, there's again no easy answers. It all depends on the dose that you're currently on. So if it's a high level or a low level, the type of medication that you're on, and how long you've been taking the medication. The higher the dose and the longer you've been on it, the longer you should take to reduce it. Now, I would suggest that you take between 3 to 6 months to reduce your medication, because often short time frames such as 4 weeks are recommended, but I think this is probably too short a period of time. So take your time reducing your medication. Now, different medications are also different. So SSRI medications are normally easier to come off than SNRIs. So SSRIs are selective serotonin reuptake inhibitors, and SNRIs are serotonin noradrenaline reuptake inhibitors. So medications with a longer half-life are easier to come off than those with a shorter half-life. So let's take a look at those SSRIs. So paroxetine, or you may know it as Paxil, has a 24-hour half-life. So this means that it takes 24 hours for you to get rid of half of a medication dose. Sertraline is 26 hours, escitalopram is 27 to 32 hours, citalopram is 36 hours, and fluoxetine is 4 to 6 days. So as I said, those with a longer half-life will be easier to come off. So fluoxetine will be easier to come off than paroxetine. So with the SNRIs, venlafaxine has a half-life of 1 day, duloxetine has a 2.5 day half-life, and desvenlafaxine has 2.5 days half-life as well. So again, those ones that have the longer half-life will be easier to come off than those with the shorter half-life. Please realize that you may have symptoms of antidepressant withdrawal, and those symptoms may look like depression. So the depression might not be coming back. It may just be related to the discontinuation symptoms. So some of those discontinuation symptoms include flu-like symptoms like fatigue, sweating, achiness and headache, nausea, balance problems, tingling, burning, or feeling like you're getting shocked. Also agitation, irritability, anxiety, aggression, mania, and insomnia. If you do have these withdrawal-like symptoms, slow down the rate at which you're reducing antidepressant medication. And also ask your medical doctor about possibly switching medications. So antidepressants with a short half-life are generally more difficult to stop taking. So switch to an antidepressant with a longer half-life and then gradually reduce the dose. Another thing to do is support your body with additional supplements as you reduce your antidepressant medication. So if you're not already on magnesium, I would recommend that you take that as you reduce your antidepressant medication. So 200 to 300 milligrams a day, and increase it to twice per day if you're already on magnesium. Glycine is another supplement that is great for calming down the body. So it's an inhibitory amino acid, and that can calm your body and calm anxiety and help you sleep at night as well. And a dosage that you would consider would be 3 grams twice a day. N-acetylcysteine is another supplement that you can use to support yourself as you come off antidepressant medications. NAC has been used for its antidepressant properties, and a dosage that you could consider is 600 to 900 milligrams twice a day. And if you use 1 or 2 of these supplements while you're coming off your antidepressants, it's really going to help you through that phase. But just remember, do not stop any medication without consulting your prescribing doctor. The ideas and procedures and suggestions contained in this course are not intended as a substitute for consulting with your doctor or health practitioner. This information is designed to augment information that you obtain from your doctor, and I'm providing you this information so that you can talk to your doctor and ask them for suggestions if it's your wish to reduce the antidepressant medications. But I just want to now talk about further integrative medical testing. So in this section, I wanted to teach you about further integrative medical testing that is available. I've included this in the course because I just wanted to make you aware of what testing is available to practitioners, and therefore what testing you could get done in the future to find out more information about nutritional deficiencies as well as your gut health. So today I'm going to tell you about 3 different tests, and I frequently use these with my clients. So test number 1 is from Genova, and Genova is the company, and the test is the organics test. And the organics test you'll often hear it referred to as organic acids. Test number 2 is also done by Genova, and it's an ion profile. And thirdly, test number 3 is called the complete microbiome test, or the GI map test. It's known by quite a few different names. And this is a stool test, and it helps us look at your gut health. So let's begin with the Genova test, the Genova organics test, or the organic acid test. And this is an excellent screening tool for weight issues, for sleep abnormalities, for depression and anxiety, chemical sensitivities, as well as a general well-being screen. So it is a urine test, and you collect the urine at home. But the test screens for over 47 different markers, and it looks for vitamin B deficiency markers, blood sugar imbalances, neurotransmitter deficiencies like serotonin, dopamine, noradrenaline and adrenaline. Looks at low energy production, so your mitochondrial health. It looks at whether you've been exposed to toxins, what your detoxification processes are like, if you have high oxidative stress or brain inflammation, as well as looking at gastrointestinal bacterial and yeast overgrowth markers. So I use this regularly with my clients, and this is just an example of the energy production section. And so what you can see here is there's a couple of L's hiding there, and where the diamonds are, that's showing that the levels of mitochondrial function in this patient is very low. And what I found with this patient here is that they were having a lot of panic attacks, and this test revealed that their mitochondrial health, or their energy production, was really, really low. So when I was provided with this information, I got my client to supplement with CoQ10 and PQQ, and their panic attacks stopped. So this test was a game changer for this client. So here's another section in the organics test, and this is looking at neurotransmitter production. So number 22 is vanilmandulate, and it's a marker for noradrenaline and adrenaline production. And as you can see there, the client has very low noradrenaline and adrenaline levels, and you can see that black diamond is on the left hand side, so it's very low. And then the next metabolite, homovanillate, which is number 23, there is a marker for dopamine. And so this client has very low dopamine and noradrenaline and adrenaline levels also. So we were able to find out using this test that their neurotransmitter production was very low. So by supplementing with tyrosine and other nutrients to support dopamine health, we were able to also help her mood and her energy levels too. So that's just a little snapshot, and it was really just looking at a couple of the different markers and information available in that test. Going on, we'll talk about the Genova ion profile, and this is another test that I regularly use. It's a bit more expensive, but it's more comprehensive again. So with this test, it's excellent for mood disorders, so depression, anxiety and fatigue, also chronic pain or inflammatory conditions, cardiovascular risk, weight issues, and general health and sport fitness optimization too. So the ion profile includes everything from test number 1 that I just discussed. So it includes the organic acid test. So as I said, B vitamins, detoxification, gut bacterial markers, mitochondrial health. So includes those 47 markers, but it also goes on and has a look at amino acids. And as you know, amino acids are the precursors to neurotransmitters. It also looks at 6 key minerals, 5 heavy metals, looks at CoQ10, which is important for mitochondrial health, looks at fat-soluble vitamins including vitamin D, as well as oxidative stress markers, and finally it looks at omega-3s and omega-6 deficiencies. The iron profile is great for the clients that have been sick long-term and we've struggled to get answers for them. So this may be a test that you want to consider if after another 3 months time the things that you've learned here in the Real Relief course just isn't enough for you to get well. So I just wanted to show you a couple of examples with the ion profile and information that we can get. So this is just a list of just one part of the amino acid section in the ion profile. And in these results here, we see that the amino acid precursors for dopamine are low. And the one on the right, the square on the right, is showing that for this client, their amino acids for serotonin are fine. So it helps us know how to treat this client's depression. We bring up dopamine and we don't worry so much about their serotonin. This next example of the iron profile test results is for the omega-3s and omega-6s. So in the top half of these test results, it looks at omega-3, and in general the omega-3 levels for this client were on the low side, whereas the omega-6 results were on the high side. So this teaches us that this client here really does need omega-3 supplementation. I have seen with a few of my clients the opposite, however, that they need supplementation with omega-6s and not omega-3s. So again, this test is excellent for anyone that has treatment-resistant depression. The next test that I just wanted to quickly go over is called the Complete Microbiome Test, or the GI MAP test, and it's a stool test. And so this is excellent for anyone with irritable bowel syndrome, with digestive discomfort, with autoimmune conditions, brain fog or anxiety. Maybe you've having persistent gut health issues, and even though that you're following all the recommendations that I've provided in this course, you still might find it hard hard to get well. So this would be the situation that you might want to use this gut health test, and it is only available through practitioners, but I wanted to show you what is available so that you know what tools you may be able to use in the future to get well. So this type of stool test is cutting edge. It uses the PCR technology, okay, and it looks for the presence of parasites, for worms, for opportunistic bacteria, fungi, yeast, bacterial pathogens, viral pathogens, and as well as normal gut flora. So I've used these tests, and it's really great because it just pinpoints what is out of balance for a client. So with this client here, they had Blastocystis hominis, the parasite, and whereas they had no worms, in this page it's showing that there's no opportunistic bacteria that are overgrown for this particular client. And then another section, this is just a couple of the sections that the whole test does, but I'm just giving you examples, whereas this test here shows you the levels of the good bacteria, and it's showing that this client's levels of bacteria on the lower side for quite a lot of the good bacterial strains, like lactobacillus. So if you're listening to this information and thinking this is something that you might like to do in the future, here's a couple of ways to get testing. Number one, for New Zealanders, you can go on my wait list. So go to my website under the consulting tab, and you can go on my wait list. Or you could ring NutriSearch to find experienced practitioners around New Zealand, and that's their number there. If you live overseas, the best way to find experienced practitioners is to contact the testing labs directly and ask them for a list of experienced practitioners. And the tests that I've shared with you today are from the lab Genova Diagnostics. So you could go to their website, gdx.net, and ask them for practitioners in your area, or perhaps practitioners that are available for Skype consultations around the world. So next I want to talk about where to from here. Now we're into the last section of the final module of the whole course, and it's entitled Where to from here. Well, first let me say that you should spend the next 3 months working through the material that has been presented in the Real Relief course. Take 3 months to implement your dietary changes and to heal your gut, because your gut will take that long to heal in most circumstances. It'll also give you enough time to do the challenge test for the low FODMAP test if that's what you need to do, and it will also give you time for your supplements to build up in your body and to treat any nutritional deficiencies that you have. But if in 3 months' time you haven't made adequate improvements, I wanted to give you some recommendations about where to go from here. Well, firstly, remember that when it comes to mental health, that we need to consider the psychological, the biological, the social, and the spiritual. Because there's many causes for poor mental health, there are going to be many different treatments that are going to be optimal for different people. Here's a few things to consider. So if you're overwhelmed with your mental health and you're not improving and you don't know what to do next, ask yourself these questions. Have you dealt with past trauma? Maybe see a counsellor or a psychotherapist to work through that trauma. Secondly, have you learnt cognitive behavioural therapy? CBT is a great therapy to learn, and it's known to help reduce a relapse into depression. Also, have you considered your spiritual life and connecting with your Creator and with your purpose in life? I would highly recommend this. Also consider, do you need to change something in your life, your job, your relationship, or your friendships? Are there areas that are creating negativity and putting too much stress on you? Fifthly, consider further integrative medical testing, and we have discussed that in the last section. So if you've implemented everything that I've recommended in this course and not making enough progress, maybe consider contacting a health practitioner that can offer you that integrative medical testing. And finally, consider testing your genetics or consider your hormones. So during the Real Relief Foundations course, we've looked at the foundational keys to mental health. So we've looked at optimizing your diet, addressing food sensitivities, supporting your gut health, and treating nutritional deficiencies. But the thing is that we haven't looked at genetics and we haven't balanced your hormones. I didn't include that in the course just because it's far too much material to put together in one place. So what I'm going to be doing in the future is creating a Real Relief Genetics course and a Real Relief Hormones course. So I hope that you'll join me on those when they are available. But here's some questions that you can ask yourself to identify whether you need to consider your genetics. So does depression, anxiety, mental illness, or worrying run in your family? Have you had poor mental health from a young age? Or is your depression treatment resistant? If you've answered yes to any of these questions, I would recommend that you consider genetic testing. Some questions when it comes to your hormones. Does hypothyroidism or low thyroid function run in your family? Is your thyroid enlarged or your neck swollen? Have you had burnout or a breakdown? Is your depression or anxiety worse when you're under stress? Do you have heavy periods, irregular periods, or PCOS, polycystic ovarian syndrome? Or is your depression or anxiety cyclical? Do you have PMS, PMDD, or postnatal depression? If you've answered yes to any of these questions, consider investigating your hormones, and I hope you'll join me in those courses in the future. So we're coming to the end of the content of the Real Relief course, but it really is my hope and my prayer that this has really helped you. If you still need answers and you're needing some questions answered, please join me for our live question and answer webinars. These are on regularly, and I'll be emailing you a link to those. I'll also be emailing you a link to a survey, and in the survey, this is where I want you to fill in your questions for me. Please send them to me, and any questions that are sent ahead of these live Q&As, I will make sure that they are answered. And at the end of each live Q&A, if the time allows, I'll be answering any additional questions from the live audience. But I'd love to connect with you there. Connecting with people makes this job worthwhile. And so if you've got any questions, please send them through. And also, if you've got any feedback for me, I'd love to hear. And if anything that you've learned in this course has changed your life, has improved your mood, or has allowed you to find out what is out of balance in your body, I would love to hear from you. I love to hear your success stories, and so please email me on support@Dr. Janelle Sinclair. Thanks so much, and I'll see you next time.